Hello, everyone. It's Darlene. I hope that you're having a great day. I'm coming before you to give you another episode of your first year information in pediatrics for first moms, or even for those who have been moms previously and are starting all over. Um, this episode is actually going to be on birthmarks. It's a lot of information. I'm going to try to give it fast, but I want to make it uh, easy to digest. So I made me a list of things to go over. If you have questions and you're not on this live, please leave comments and I will try to address your questions later. Again, I hope these episodes for your first year are beneficial. This is the installation to that. Again, we're going to cover birthmarks today. So, I will refer to my notes so that I don't skip things. The first thing I do want to do is talk about birthmarks in general. When you hear the word birthmarks, you think that the birthmarks are there present at birth. Okay. So the first misnomer is that birthmarks do not have to be present at birth. A great majority of them are, but there are some that develop in the first week of life, and there are some that develop in the first months of life, and there are some that you actually will develop throughout life. So, yes, they are birthmarks, but they are not necessarily present at birth. Um, the birthmarks may be flat or they may be raised. So you may be able to rub your hands across it and feel nothing, or you may actually feel something underneath your fingers when you're on top of the birthmarks. Some of these birthmarks will grow, and I will talk to you about the ones that will grow. We can break down birthmarks into two categories: vascular birthmarks and those that are not vascular, not associated with the blood vessels. If I use a medical term, I will try to remember to also give the layman's term for that medical term. Some of these birthmarks will grow over time. Um, a lot of them will be proportional to the same size it is to the body when you're small as when you get big. Okay, and just like some may grow, a lot of them may disappear over time. Or you have birthmarks that you see very easily as infants. They tend to fade, but there are situations later like fever or anything that increases blood flow where you can see those birthmarks because they're not totally gone. Okay, so I want to cover vascular birthmarks first. And there are four vascular birthmarks that I want to cover. Uh, Probably most of these early say, oh, yeah, I remember somebody with that. The first one, um, excuse me, I'm going to have to turn on my vehicle because my internet connection is getting weak. So give me 1 second. Okay, thank you. I apologize for that. All right, the first vascular birthmark, excuse me, I hope I'm not making you dizzy. The first vascular birthmark is called hemangiomas. Um, and there are two types of hemangiomas. There are what we call the strawberry hemangiomas or the deep hemangiomas. The strawberry are usually bright red in color. The deep hemangiomas are usually blue gray and they usually are raised so they feel like a bump. The deep are not usually present at birth. They occur within the first week or so or months after birth. Hemangiomas are known to grow rapidly within the first year of life. So they may start out with just a little red flat spot, and then all of a sudden you have this red raised bump. And then they flatten after that time and fade. The important thing about hemangiomas is that some may also form in the organs or on other internal structures. So, if this is of concern, then further evaluation should be done. The other thing, before I go on much further, to remember is that most birthmarks require no intervention, but some birthmarks will require some sort of treatment. With hemangiomas, um, if they are in an area where you have rapid growth and there is a possibility of deformity because of the rapid growth, then treatment should be administered. Or if they're in an area where they will interfere with the function, such like if they're near the eye or near the airway, then those birthmarks need to be treated. And hemangiomas can be treated with medication or they may be treated with laser therapy. The next type of vascular birthmark is referred to as a salmon patch. Other names for it is called vascular stain or nevus simplex, and lay people often call the ones on the back of the neck or the back of the head stork bite, or if they're on the face, the forehead, or the eyes, angel kisses. I'm sure you probably have seen these, but they can occur anywhere, and they almost always fade. But because they fade does not mean they disappear. In fact, I saw an adult male today who had a large stork bite on the back of his neck and head, and the first thing I thought, "Wow, I wish I had a picture of that," but I was in a hurry and I didn't ask him for it. The next vascular birthmark is called a port wine stain. It is less common. It is usually present at birth and commonly occurs on the face. Initially, the port wine stain is flat and pink or red, and then as time goes on, it becomes a darker red or purple in color. Um, the important thing over time, um, and port wine stains can grow in size, meaning that it can grow out of proportion to what it used to be. Um, Also, importance of port wine stain is that sometimes it can be associated with a genetic condition called Sturge-Weber syndrome. My fourth vascular birthmark is called venous vascular malformations. And just like the name says, it is a group of veins that dilate or enlarge in size. They appear red or purple in color. They may be present at birth or appear later in childhood. They grow very slowly. Think about the veins that they grow very slowly. They do not fade on their own. That is the end of the vascular birthmarks. Now I'm going to cover some other birthmarks that are very common, that are not vascular in origin. And most of these birthmarks are brownish in color. And there's one exception to this, but I will go through them all briefly. Again, I will refer to my notes. The first of these, which is the most common, is called cafe au lait, which is a French word which means coffee with milk. And that's exactly what these birthmarks look like. They look like coffee that has had milk put into it, so they tend to be a light brown in color but may darken. They can be anywhere from a light brown to a dark brown. Um, they usually have an irregular border, and they can vary in sizes from teeny small ones to very large ones. The importance of cafe au lait spot, um, they may be present at birth, but most of them appear later. So again, the misnomer of birthmark, about 30% of them will appear about 6 years of age. And the reason that these marks develop is because the cells produce excess melanin, which is what causes the brown pigmentation